In today's episode of Catching Up with Dental Students, we are going to be talking about the incredibly common topic of dental anxiety. So what exactly is dental anxiety? It is a term that describes an aversive emotional state of apprehension or worry in anticipation of dental treatment. It affects both the patient's health and psychological well-being as well as the clinician's level of stress in practice. Dental anxiety is prevalent worldwide, affecting around 37% of the Australian population, meaning nearly 1 in 3 of your friends may be suffering from this too. These individuals often find themselves in a self-perpetuating cycle of fear that leads to delay in seeking regular treatments and limits them to highly invasive treatment options. In 2010, a study conducted by Issa, Freeman, Humphries and Savithri reported that anxious patients are more likely to have caries, missing, and cavitated teeth in comparison to non-anxious patients. So what causes dental anxiety? The etiology behind dental anxiety is categorized into exogenous and endogenous sources. Exogenous sources means that the individual source of anxiety is external. The first exogenous source comes from direct previous traumatic experiences. It has been reported that individuals with high level of dental anxiety often attribute their fear to a traumatic past dental event, also referred to as conditioning via aversive treatment experience. Other distressing experiences, such as sexual assault, can also cause dental anxiety. Sexual assault victims often associate lying flat in the dental chair with negative emotions and a more pronounced gagging reflex. The second exogenous source comes from indirect vicarious experiences. Vicarious learning means indirect learning from role models such as family members, peers, or the media. Children often indirectly learn to be anxious by observing the behaviors of those around them. In a study conducted by Locker and others, 56% of the participants who reported with child-onset dental anxiety had a parent or sibling who also suffered from it. Parental teasing and fear of judgment are also identified as a cause. This includes judgment of their oral hygiene habits from the dentist, judgment of the condition of their mouth, and judgment or fear coming from related costs of treatment. Lastly, the negative portrayal of dentistry in the media is the final cherry on top. Now, endogenous sources describes individuals who are dentally anxious for internal reasons. Firstly, there's actually a genetic component associated with dental anxiety. So if you ever wonder why you're scared of the dentist, but can't really put your finger on it, this might be why.